If it's okay with our speaker, I'm going to go ahead and get started.
Sure.
Okay, thank you. Welcome and thank you for your support of the BIADE webinar series. Our guest speaker is happy to answer any questions that you may have. Please make sure that you post them in the chat. And I'd like to also take an opportunity to thank our sponsor, Highmark, for making this webinar possible. We're going to go ahead and get started. And Jessica Walker, who represents the PeachTree Health Group, is going to be discussing what community and home health-based programs can really do for you. And if you're just joining, first of all, welcome again. And I'm going to go ahead and welcome everyone and say my name is Zawaya McElrath. I am the Executive Assistant for BIADE. We are honored with a special presentation by Jessica Walker from the PeachTree Health Group. She is going to discuss what home and community-based programs can really do for you. And before we get started, I just have a few reminders. The webinar will be recorded, and I will be uploading the webinar to the website, BIADE's website, as well as on our YouTube channel. I will also be sending out the speaker presentation along with a link to the recording within the next 24 hours. And please share it with your network and all of your constituents. And I'd like to introduce our speaker today, Jessica Walker of the PeachTree Health Group. Thank you.
Thank you so much. PeachTree is very excited to be here today, so thank you so much to BIADE for the invitation to really talk about some exciting community services that have been so desperately needed in the state of Delaware. With that being said, I'm just going to go ahead and get started. So PeachTree Health Group is located in Harbison, Delaware. That is in Sussex County. So basically really close to Rehoboth, just so you guys can kind of picture where we're located. Our mission, hold on, I got to move my box over a little bit, is we are dedicated to addressing each resident's individual needs, rebuilding necessary cognitive, physical, and social skills, and progressing towards functional independence. Our mission is to provide an exceptional level of care across the board for our brain injury survivors. So PeachTree Health Group specializes in the brain injury population. We are an innovator. We are community-based. With that being said, we are the only community-based program in the state of Delaware, so that's pretty exciting that in our own backyard, we have these services available. Our mission is to maximize the capability of those affected by traumatic and acquired brain injuries through individual programs, meaningful interaction, and exceptional care, of which I'm going to dive into later on in the presentation. We strive to provide the highest quality of brain injury rehabilitation services and do it in such a manner to allow residents to want to be involved in their individual plan of recovery and to look forward to achieving their daily, weekly, and ongoing goals. By putting the resident first, we recognize that they are the reason that we operate, and we can champion the rehabilitation process and services provided. Okay, so I wanted to just kind of go over what is a brain injury. For most part, I would think most people would know with our community here. However, there are two different types. There's the traumatic brain injury, or known also as a TBI, and this is caused by an external factor such as a bump, a blow, a jolt to the head, something that's going to disrupt the normal function of the brain, and this could be closed or an open injury. An acquired brain injury is an alteration in brain functioning or pathology caused by internal factors, such as a lack of oxygen. A brain injury may produce an altered or diminished state of consciousness and result in an impairment of cognitive abilities or physical functioning. So there could be a wide array of services that these individuals may need to increase their independence or to maintain their level of independence. It can also result in the disturbance of behavioral and emotional functioning. And these impairments could be temporary or permanent and cause partial or total functional disability. On this slide here, these are just kind of just the most common examples of TBI and ABI. So of course, our program participants, they may have had a fall, they might have been assaulted, a victim of assault. Motor vehicle crashes is a pretty big contender for up in the top 3. They could have had a workplace injury. It could be at the hands of abuse, unfortunately. Some of the more common, probably in our older population, are something like a stroke. That is an example of one. Seizures, tumors, and metabolic disorders. So those are all examples. However, that is definitely not the limited list. It's actually a pretty lengthy list, so I just kind of shortened it up there. So results of a brain injury. So it can cause a wide range of functional short-term changes affecting thinking, sensation, language, and emotion. And then, of course, according to the Brain Injury Association of America, brain injuries can cause an impairment of cognitive abilities or physical functioning. It can also result in the disturbance of behavioral or emotional functioning. Cognitive consequences can include memory loss, slowed ability to process information, trouble concentrating, organizational problems, and poor judgment, and difficulty initiating activities. So all these examples, I think it's a fair statement to say each injury is completely different. Everybody reacts differently, and everybody rehabs differently. So some of the physical consequences, those could be your seizures, fatigue, headaches, balance problems. And of course, there are the emotional and behavioral consequences that can include depression, mood swings, anxiety, impulsivity, and agitation. Brain injury can also cause epilepsy and increase conditions for a risk of Alzheimer's, Parkinson's, and other brain disorders. And of course, repeated mild TBI, such as like a concussion, that can certainly accumulate neurological and cognitive deficits, and then repeated mild TBIs occurring within a short period of time can be catastrophic. So that was a lot to digest in one slide, but as you can see, there could be many factors of where an individual may need very specialized services for them. So I just wanted to go over like the basic description of what home and community-based services means. So this would be any traditional home and community-based services. This is going to ensure that people can receive services and supports through Medicaid's home and communities program and have full access to the benefits of living in a community and can receive services in the most integrated setting. PeachTree is integrated in the community, so we have access to all these community programs, fun events, therapeutic events. So we like to bring our residents out into the community. We're also going to be able to provide a safe and supportive home-like environment. I think that's really important. So home and community-based, we are designed by nature not to be institutionalized. That is our goal. We want it to feel like home. We want it to feel like it's a normal piece of the community. And it's also going to allow individuals to age in place while encouraging their independence. We're keeping them safe, and we're also stimulating them along the way. So it's really great that they have a safe space to age in place. So PeachTree Health Group is not only just a brain injury program, but we are an assisted living. So a traditional assisted living setting would be for people that just need help with daily care, but maybe not as much as a nursing home. Assisted living residents usually will live in their own apartments or rooms and share common areas. They'll have access to services, their 3 meals a day, assistance with personal care, medications, housekeeping, and they'll have on-site staff. And then, of course, they will have access to social and recreational activities. So that is your traditional assisted living facility. So what you may ask is, well, what makes PeachTree Health Group different? Well, there's quite a few things. And the great thing is we have them right in Delaware. Okay, so PeachTree Health Group is very unique. We have distinctly qualified physicians, nurses, therapists, and other team members who specialize in understanding brain injuries is just what we need to help the residents succeed in their new home. So we have, our staff is trained specifically for the brain injured population. So similar, like if you were to go to a skilled nursing facility, they primarily focus on dementia and Alzheimer's. Well, we specialize in the brain injured population. So we understand this. We eat, sleep, and breathe it. We're also thrilled to present as the only assisted living setting that offers this therapeutic program, and it's one of a kind in the state of Delaware and surrounding areas. So it is safe for me to say that nobody else in the state of Delaware has this specialized program as an assisted living. Prior to PeachTree Health Group being able to advocate for services for the brain injury community, residents of the state of Delaware were actually being sent to other states to receive these services that we now provide. So as you can imagine, that could be very disruptive. First of all, to somebody with an injury, just the resident first, but then also to their family's dynamics. Having your loved one, I know of one person right now that's in the state of Maine. They've had to go all the way to Maine to receive services, but now that there's a place here in Delaware that can offer these services, these residents that have been displaced can now return back to the state of Delaware should they choose so. PeachTree Health Group, we have our own therapeutic program in-house, and that is consisting of both cognitive and behavioral therapy, and that is designed to help them maintain their cognitive levels, and also to improve any behavioral instance they may be experiencing. So here is, let me just move my thing here. Here are just a handful of examples of what our therapeutic program focuses on. So it could be something as memory recall, group integration, coping skills, money management. And as I go through these examples, understand that when we do receive a program participant, we identify their needs individually. So this is not like a blanket therapy program. This is specific to their individual needs and what they personally need to work on. There's also decreasing social anxiety, anger management, promoting independent living skills. So they're gonna work on, hopefully, one day maybe being able to move on to a different setting, if that is something that is possible for them. De-escalation techniques, improving their social appropriateness. So these are all areas that we do focus on, but it is not limited to these lists. So one of the really great things about PeachTree is our community integration program. We have our residents in the community a lot, and they love it. So not only do we hold our in-house therapy, we also take what we learn from those therapeutic sessions and apply it to everyday real life scenarios. So we may focus on social, intellectual, vocational, leisure interest. And again, this is all done with the therapeutic team. So when they go out into the community, their therapists are going with them and they're working with them actively in real life scenarios. We also offer cognitive rehabilitation therapy. This is going to focus on, maintaining that cognitive level, working on very specific things with each resident. That could be problem solving, organization, their attention, keeping that attention span with them, and their memory. And word finding is also on that list as well. But that is one of our areas that we do focus on, is the cognitive rehabilitation. And then we also do behavioral therapy. So behavioral therapy, I think, is really important after a brain injury. It focuses on the changes that may show up in the way people feel and express their feelings. I think, one of the things after having an injury is, there's a sense of frustration sometimes, and how do they express that? So that's one of the things that we help them navigate at PeachTree. So we'll focus on their resident social and interpersonal conflicts, and we'll help them with behavioral modifications. We will also look at the underlying issues, and those could be, OCD or post-traumatic stress, or other mental health disorders. The treatment that we do invokes positive reinforcement. So we're teaching them new, healthier behaviors. That's our goal. Okay, so our structured day program, it consists of the cognitive and behavioral rehabilitation groups 5 days per week. Their groups could range from the basic skills of cooking and money management to more complex topics like coping skills. We are rebuilding their skills caused from the injury. Residents also participate in structured day outings 5 days per week that focus on community integration. So that is basically what a day in the life of a resident will look like throughout the week. They are constantly working on things, but I also say the best type of therapy is when you don't realize that you're in therapy. So like I said before, they do the structured day of the cognitive and behavioral groups, and then they're also going to take those out into the community and involve them in real life scenarios. And that's, kind of the fun part, and seeing the beauty of them working on their skills so much, and then now you get to see it in a real life situation. It's a really great thing for us to see. Here is just an example of our community outings. This is actually for this month. So as you can see, they have a very busy schedule, and this is normal for us. So they may go out just for a simple Dunkin'. They might go out to lunch. They also do volunteer work with Meals on Wheels. They're also going to a sporting event. Our women love their spa days. So there's a lot that they have to choose from of what interests them, and then also to what is pertinent to their person-centered care as well. Okay, so additional facility services. At PeachTree, we offer 24-hour nursing care. What also makes us really different is 24-hour on-site security. That is something that you very rarely see at an assisted living, but we do have the security staff on site just because we know that we serve a very vulnerable population. Of course, we have the individual therapeutic and nursing plans, medication management, we have our outings. So even though I talked about our internal therapeutic program, we do still have access to occupational, physical, and speech therapies. So just know that those services can still be provided at our program as well. All of our rooms are private rooms. That is a very big thing. We know people like to hear. So not only do we have private rooms, but we also have private bathrooms. Within our program, there's also 9 team centers. So we could have up to 9 therapeutic sessions going on at one time. We also have an exceptional dining experience. We do not get complaints on food. They love our food. And we also have servers that help serve the residents their meals as well. They have the option for indoor and outdoor dining. We do have a basketball area, and they do love that area a lot. Outdoor patio as well, where they do like to go out there and enjoy some fresh air, a walking trail. And each floor has like a home-like common area, like a living room that has a flat screen TV. So if they want to have some leisure time, they can go there, or they can also, of course, enjoy their room as well. So that pretty much sums up PeachTree. So some people may ask, well, what is the admission criteria for PeachTree? So for PeachTree, first and foremost, that individual must have a traumatic brain injury or acquired brain injury diagnosis. We only serve that population. If they do not have that diagnosis, then they are not a candidate for admission for us. We also need to satisfy the assisted living level of care requirements. So what that basically means is they cannot be fully dependent. They could not be, bed bound. They need to be able to do most things for themselves. But of course, that's something that we would navigate on a case-by-case basis. Also, to our payer sources that we do accept is Delaware State Medicaid. We do have contracts with all 3 MCOs, which is Delaware First, Highmark, and also AmeriHealth. You could also do a private pay. There may be VA benefits. So there's a lot of different payer sources that we do accept. And with that, that is basically all for PeachTree, but I'm open to any questions that anybody may have.
Did anyone have any questions for our guest speaker?
Hi, Jessica. It's Cheryl. How are you?
Good. How are you, Cheryl?
Good. I don't have a question. I just wanted to say thank you.
Absolutely.
Really a lot of good information. Thank you so much for taking time to share it with us.
Absolutely.
Many of our constituents do prefer to watch an on-demand kind of version, so don't be discouraged with this small group today. We do find that triple and sometimes quadruple the number of people actually watch it. We've all gotten spoiled. We get to watch it on our own time now.
Nothing wrong with that. I completely understand.
Yeah, a lot
and
of good
again,
information though.
And, you know, if you guys can share my email address if you'd like, if there's other questions that do come up for those individuals who are viewing at a later time. You know, also too, I would like to say that even if Peachtree cannot help somebody, we can usually help facilitate finding the answers. So if somebody does have questions and maybe they're not ready for Peachtree yet, or they're just trying to figure out, you know, how does this process start? I'm happy to start that conversation as well.
Hey, this is
Yeah.
Karen McLaughlin from Public Health. I just want to echo Cheryl's thoughts. We really appreciate you coming on and sharing all that
Absolutely.
information. And it's wonderful to hear how Peachtree has grown and is really providing these services to our community. So thank you very much.
Absolutely. Thank you so much, Karen.
Okay, thank you everyone for joining. Just a few housekeeping notes. As I said at the beginning of the call, I will be sending out a copy of the speaker's presentation along with her email address and a copy of the recording. I will also post it on BIADE's website as well as our YouTube channel and on our social media outlets. And Peachtree sounds like a great organization. So please, if you know anyone that needs help or referrals, please reach out to Jessica. I will be sharing her email address. And thank you again, Jessica. Thank you, Bridget, as well for pulling this together. And I want to also once again thank Highmark for making this webinar possible. Thank you, everyone.
Yes, thank you guys so much. Thank you so much.
All right.